like 10 minutes, I could roast you and you'd be like, I'm not in the happy mood right now. Shut up. I'm not in a joking mood right now.
Who then?
Feel like joking.
Amanda.
No, I'm Hamid.
Ahmed. Okay.
If he's in a joking mood, we're all good. And then sometimes I'll crack a joke
No,
and he'll
have
be
you
like,
noticed-
I'm not joking anymore.
Have you noticed though?
It's
When
over.
I start doing surgery, I'm a
Yes.
different person.
Surgery
Have you
is
noticed
different.
that?
I
Okay, but
completely
she's not
get.
even talking about the owner. She's
Are we
like,
on live?
You're on
Oh,
live,
okay,
no
so we
problem.
can say.
Oh, we're roasting. We're done.
Okay.
see exactly what you're saying. No more jokes. Hi guys, thanks for joining. This is Essence of Medicine. Today we're going to be talking about surgery training around the world. My name is Amanda Armagast.
My name is Alyssa Hopper.
And I'm Dr. Abbasi, and we have a very special guest. Dr. Amir Sharif is a very accomplished surgeon, has been training practically on 3 continents. He's from my home country, Iran, and we are going to talk about some of the education in Iran. He has then traveled to Germany. He's currently practicing in a high-level spine practice in Germany, close to Hamburg. Who doesn't know Hamburg? And recently we were there, and we were really amazed by the level of the efficiency they bring to spine surgery right where he's practicing. But he has been traveling now to US just less than almost a month later, coming and visiting for us. Well, welcome, Amir,
Thank you.
to our humble the den of surgeons.
Yeah, thank you. I appreciate your invitation. I thank you guys a lot that you organize everything so fast. So that was that was pretty cool workshop that we had. That we had you guys over there. That was 3rd of July in Hamburg, and now in exactly less than 1 month, I'm here, and I enjoyed your techniques in reality.
Let's talk a little about how did you get to know us, Amir?
Through LinkedIn.
LinkedIn, yeah.
Yeah, afterward we talked, and we found something in common, and then passed, and we get connected. But the first point of that was LinkedIn.
Yeah. No, and then we came to Hamburg, and we really enjoyed that. And then less than probably 6 weeks or so, you're already here. Now, before we go about the education in different countries, let's talk about our educational effort that we have put in place. And we came there because you were interested for this technique and so on. And then you came here today. Yesterday, we actually, yesterday and today, we had these cases that we went through together. Yesterday, you saw those patients a year after the surgery, a few months after the surgery. I would like first, have your experience about this, because this is part of education. You are somebody who's never done with education, and that I admire about you. Many surgeons I meet, as soon as they leave the residency, their education is done. They have a tool set for the rest of their career. They're set. That's all what they do. And then, obviously, when the time goes on, the expertise becomes behind the current of time. But you are not one of them. You just going everywhere to learn new things.
Exactly.
And you're always, we have a saying in Persian, it's an old poem, says, from the cradle to the grave, seek knowledge.
Yeah.
It's an old poem that from Sadia, actually, that says, from the cradle, when you're born, until the grave, when you're dying, always seek knowledge. And you are a true example of that. But let's talk about your experience yesterday and today. But tell me, first of all, what motivates you to learn all the time? And what do you think, what was in the last few days you were with us? What do you think you learned?
So I have to tell, when I go with for something, I go all in. So and now I'm seeking the word of spine surgery, and for sure nowadays the minimal invasive surgery is a hot topic. And I started to look around. Okay, what can I learn more? And then we got to know each other. We started that, and I saw so many videos. It was like a click. Okay, so that should be something. So I saw so many videos of you, and then we talked. We had so many video talks, meetings with each other, and we could manage it. That you, that was so kind of you guys that you spend your time and you came to Germany just for education. I have to appreciate it now, without any special financial interest, what we see in nowadays world.
Yeah.
So you guys came there, and we had a great time, and we learned a lot. So when I saw that in Germany, what you're providing, I was so curious to find it. Okay, what is exactly in reality? And so I used your kindness that you told me. I mean, you're anytime you're welcome here. So I just
it, doesn't it?
yeah, and it's really like it. So it's very good to be their guest here. So
Thank you.
yeah, I appreciate it a lot. Dear Amanda.
Well, we have built a concierge 5-star hotel just for people
Yeah,
who are willing
just
to
for me.
learn. Just for you.
I appreciate it all from you.
Yeah.
Yeah. So and then the good thing is that we did this combination of 2 days, 1 day clinic that I could see patients. And so I have to tell it honestly here. I just thought, okay, Hamid is just talking about surgeries. Maybe he's also one of the surgeons that he has always knife in hand. But I can tell you yesterday, more than half of the patients, he was emphasizing and insisting on, please do the conservative therapy as much as you can, as much as till the time that is really the right time for surgery. And he knows what he's talking about. And you were also insisting on, please have a second opinion. Yeah, that was so impressive for me, that I liked a lot. And I had the chance to see patients after 1 year surgery, after 1 month, and the patients, they are indicated to get that, and also for SI joint and for Olive. So it was gestern. It was, oh, I'm sorry, I switched to German. So it was yesterday, very good opportunity for me for that, because in the spine surgery, putting the indication and the right time for surgery is really one of the most important part of it. You know, I have done also trauma surgery. In trauma surgery, so a patient is with broken bone there, you have no other chance. Yeah, you should get everything together. You should make it right. But in a spine surgery, as you know, yeah, you're a senior in that. So putting the indications was very special. And now today we did it practical, and I was so amazed. You know, the workshop that we had in Germany, that was awesome. But today I saw that in reality, and the operation that you have done for SI joint and also Olive, both of them, they were brilliant. I really congratulate that to you, that you have done lots of effort for that, and also for giving this information to junior surgeons like me. Yeah, you know, because nowadays, unfortunately, it's not completely like this, not so like that. We don't see that much seniors or mentors like you to give it like that for free to the others. But it's very good to have you there.
Thank you. Now, first of all, I appreciate that you noted that we are not trigger happy surgeons.
Yeah.
That everything we maximize, we have made a protocol for that, you know, we have called it multidimensional, inspired by multidimensional conservative management protocol, that there are only 3% of the cases that we see them and schedule them for surgery. If they have instability and progressive weakness or progressive neurological deficit. And if we have made a protocol that Alyssa, even though, you know, she's just 1 year out of the school, can really comprehend what the protocols are. Now, as well, we know human biases. Now, as a surgeon, I know some days I want to do surgery. So for that reason, we made it independent from surgeon. There's a checklist that if I don't recommend, that's a part of my checklist. That what I did, I was just following the checklist that we put together that I have to recommend second opinion. Patient doesn't have to get it, but I have to strongly encourage them. And I have to put a checkbox that patient has done complete amount of physical therapy appropriate for that kind of problem. So and that sort of making it a protocol, we make sure that everybody does it. It's not like a bossy special, it's a group things. And once you start doing that, that becomes your second nature, that you truly, for some surgeon, that is a thing that I don't want to do physical therapy. I want to do surgery. I'm a surgeon. But once you start following the protocol and, because my scheduler will bounce it back. If patient hasn't done physical therapy, if he haven't, recommended the second opinion, they bounce it back to the surgeon. But once they need a surgery, we have other protocols. Now, what you watched today morning, do you want to describe the details of the surgeries that you observed today? Now, the sacroiliac joint and Olaf, what was special about that compared to what you have seen today? And you came and told me you want to congratulate me about that. That
actually,
that a lot to me from you. But what was different that you thought it's worth of a congratulation?
Yeah, actually, because that I know how much effort you put that. As we know, if we look to the surgery history, there were always conventional procedures and innovations. And always for innovations, there are a little bit, I don't want to say older generations, but the senior generations, they are a little bit, I can say, defensive or not that flexible about that. That I can also understand. So because of that, every innovation needed a little bit time and had lots of challenges to go through to be settled down. And I can feel that how much effort you put on that. And the result of that is what I saw today, that you have done a surgery that is normally for fast and good and experienced surgeons in at least 1.5 hours and at least 300 to 400 milliliters bleeding. You have done that in almost 30 minutes. And you have done that with very, very little amount of bleeding. And you have done that with lots of safety. With the nerve monitoring, we could make ourselves sure nothing is damaged. And then also with good results. We have seen the results already. So
2 of the patients are already discharged. The third patient
the only reason the third one's not is because they got out of surgery, but now they're still kind of dizzy. So
that was actually the main part that I so impressed about it. If I'm allowed to put name on that or label that, I can say you in Inspire the Spine try to put special standard care in spine surgery, that you provide that is, I can say, special spine care. That is that you have your own standards. For example, like what you said about this checklist, it doesn't matter you do that or a junior does that, or your other colleagues, they do that in Inspire the Spine, and that should go all of this way and with this checklist.
Unify the approach, One of the sad part of the spine is, the joke is, I have told that joke 100 times, but if you give 5 spine surgeons one case, you come back with 7 different opinions. And the studies are out there. The kind of treatment you get for the spine has nothing to do with what kind of pathology you got. It has all to do with who you meet first. And we are trying to get those biases out of the way, protocolize and unify the approach to the spine. And that is what you are referring to, that exactly. Thank you for the observation that means if junior partner or enough different surgeon, if we follow the same protocol and we will enforce it, we will have the same approach. Nobody gets after 2 visits of physical therapy a surgery.
Yeah.
Nobody get a surgery if they haven't truly understand all the implication of the surgery, because we recommend second opinion. Our scheduler just wouldn't schedule that. That's as easy as that. And because it's our approach is unified, the patient truly can trust us. Like one of the patients we did today, flew all the way from Vermont to get the surgery in our surgery center. And because patient truly understand the value of this effort that we put in place. Now, let's talk a little about this, education. You had an extensive education. I like a little to know more about your education in Iran, and that I can add about your education in Germany. I had some education in Germany. Let's talk a little about that.
So I can just say a summary of my CV. How was it? So in 2005, I started my medical school till 2013. And after that, for 4 years, I was working more as emergency doctor and general surgery in different hospitals.
What do you think the level of the education you got? How satisfied were you with your skills when you went through that education?
So for sure, it's a little bit complicated. You know that we faced the first day that you go in university with lots of theory stuffs, lots of basic science, and afterward you go into clinic and you face lots of things that is for you a new world, and making that integrated and making the connection between basic science and clinical science, and after that also surgical science, is not that easy. But I can say I appreciate that I knew so many seniors, and I was always so enthusiastic for surgery. So I had always good places. I had always good opportunities to go and learn more. And over there, from theory side, and also from amount of patients that we had, I could collect lots of experiences till the time that I came in 2016, end of 2016, beginning of 2017, I came to Germany. And from that time, I started my experiences in Germany. And March last year, I did my board exam. So in March 2022,
Germany?
Okay. I got the board of trauma and orthopedic surgery.
Excellent.
But I see that now, this workshop and today that we had, because, last year I did 15 courses for spine surgery, and most of them from German Spine Society. Yeah.
That's a lot.
Yeah, just in 1 year, 15 courses. Yeah. But I can say I loved what I got here,
Thank you. No, I want to go back to Iran, because in Iran, it's not a place that is famous for the medical care, but I can guarantee you, and I know that as a matter of fact, there are certain things that the Persian or Iranian doctors are expert on.
Yeah.
Like sex change operation, from all things.
Okay.
That's high. The second highest number of the sex change operation in the world is in Iran. Doesn't matter what the political background of that is, but they're expert on that. Another thing is the trauma, especially war trauma. After 8 years of war with Iraq in 1980s, the Iranian surgeon, surgery is a doing job. And it's about an Iranian surgeon, they do a lot. And that adds a lot to the experience. And all the trauma, lots of standards for trauma, for spine and brain, for war-related trauma, like gun injuries, are created in Iran. After we had 1 million injuries or more, and there was a lot of data and for how to deal with them and so on. And as well, especially the neurosurgeon, orthopedic surgeon in Iran, they have a high volume. Exactly. I can guarantee you, for every surgery that the surgeon in Germany or even United States does, they do 5. And the surgery, the volume, the experience that they get. So it is certainly the level of the technology is not maybe at par, like like they don't have $1 million intraoperative CT and so on and so forth.
Exactly.
But the level of the experience, now you remember our joke, Amanda, that I have the most advanced computer between my ears and I have the most advanced robot
Yeah,
attached to
yeah.
my shoulder.
Goodness.
There are lots of advanced computer and lots of advanced robots in Iran, but it's not even specific to Iran. I see lots of Indian, Pakistani surgeon and so on. They are rich on skills. Maybe they are low on resources, but they're rich in skills. And guess what? That's one of the things what we love, because to do OLEF, to do sacroiliac joint, you need a very minimal set and lots of skills. You don't need $1 million robot.
Yeah.
And that
Exactly.
is why we are excited to go to India soon, or to other countries. And so I really appreciate that you did your initial education in Iran. I think you got a fantastic tool set coming with you. And
Exactly.
certainly you said that was a hard transition going from theory to practical, but that I think everybody around the world
Yeah,
the same thing,
Yeah, exactly. Yeah.
So, but let's talk about, I trained in Germany. I want to a little know about your German experience in the healthcare and in the medical practice.
Exactly. From which point of view? Yeah.
No, well, you said you went to Germany 6 years ago, 5 years
Yeah,
ago.
exactly.
If you compare the practice of medicine in Germany to Iran, what are the differences you notice?
Oh, well, so it's so well organized. The standard is so high, and for sure the instruments and the equipments that we have. And another part of that is that in Germany, the healthcare system is so good for everybody.
Socialized medicine.
Socialized, yeah,
Socialized
exactly.
medicine.
It's so everybody can have the best possibilities that are there. It doesn't matter if a patient comes to even there to ER. It doesn't matter is a homeless person or is a multimillionaire person. So they get the same care. Yeah, and that helps a lot. Helps a lot to evaluating the patient, to use all of the instruments, to use all of the facilities to make the diagnosis and do the therapy. And that helped me a lot to learn it. But for sure in surgery, in Germany, you have to do a lot yourself. You have to show your motivation. You have to go for it. You have to fight for it to get more experiences. Yeah.
I love what you just said, because that's exactly the difference I noticed from Germany to US, that you have to be a lot more active and do a lot more in Germany, whereas here you get a lot of support from your team and surrounding in the hospital, in the medical system.
Yeah. No, over there, it's more depends on you yourself. Yeah, it's not like here that you have a program and you have a schedule. You come this day in, you come that day out from the program, then you have to go for it yourself.
That is residency in Germany is like there are not one residency for orthopedic surgery or neurosurgery. There are 1,000 residency, whereas here it's very well organized. And if you don't keep up with that organization, with that program, it's truly a program to shut you down, literally.
Yeah. Exactly. But over there is also, there are some persons that you see for 10 years or for 15 years, they are still in residency.
Yeah.
They don't also easily get out from that, or they don't easily get the permission to do the board exam. But to reach that point,
Do you have to test out, or?
It's not like test, but everything is observed. Everything is you have log books, and you have also every year you have evaluations from head of department, and they decide how it's gonna be and what's gonna be your next step.
Whereas here is more organized above the head of the department chair. There's so much depending on one person, how you progress in your program. Whereas here, it's a set of program, like a checklist. Like there were some program, if you didn't give the residents here in the United States, program that if you don't give the residents certain set of surgical experiences, you have to send them out. You have to send them out. They stay in one place, in one program. The program has to send them out to get those skills.
Yeah.
Whereas in Germany, you have to change position to get those set of skills that you need.
Yeah.
And the program director or the residency program, or that's not a real program, the position you're working, they have no obligation to give you any skill whatsoever.
Yeah.
If they don't have it, okay, go somewhere else to learn that and so on. Whereas here, those programs would be shut down if they don't give those skills within certain time period.
Exactly. Yeah, exactly.
And I really enjoyed that part when I came here. It was clear I'm in a program. I start this day, and every year I'm going to the next step. As a matter of fact, every 3 months you go to a next step. Sometimes every 3 or 6 months you move to the next step. And then within those next steps, your required set of skills that you need to acquire. And then you have to do your written board in certain, it is truly from beginning to the end of the program. And I cannot tell you how much I appreciate that.
Yeah, and but I have to tell you also, in some centers in Germany, it's also nowadays like that.
Good,
Yeah,
good.
they have very well organized and with completely clear rotation plan.
Good.
Yeah, then there are so much motivation in that for the new generation of the head of departments that they try to change a bit.
Yeah, but it is that is a fantastic thing, and I think this will be established in most of other countries as well.
Mhm.
But that is up to that place, to that hospital, to set up that rotation and schedule and so on.
Exactly.
Whereas here in the United States, there is a accreditation committee for educational system. They dictate
Yeah.
down to the thing. So the hospital, they don't have a choice here.
Yeah, yeah. It's kind of also over there like that, but it's gonna be very good observed from the State Medical Council.
Good,
Yeah,
excellent.
they have good eye on that.
Good. That's so lots of things are changing there as well.
Yeah.
Now let's talk as well a little bit. I think we covered the Iran, Germany, and United States,
We have 10 minutes.
and we have still 10 minutes. But we can,
Okay.
what else do you think? You're going still around the world, and you're observing a lot of surgeons.
Exactly.
You're just adding to your repertoire. Tell us about your recent experience in the workshop. You said you have been in 15 workshops and so on.
Yeah.
Let's shift gear and talk about what do you think what the hottest thing in the spine? You are the best person to know that after having done so many different education.
Yeah, actually, for sure, I can say if you ask me about the hottest topic is nowadays for sure minimally invasive, as I also have seen that in Global Spine Congress in Prague this year, 2 months ago, that everybody talks about it. Yeah, and that's one subject, and the other subject is also reducing the complications in other surgeries that we already have. If I want to add something on that is the tumor. Yeah, nowadays you can do a lot for the tumors in the spine, what was not that common and easy in the past.
So let's talk about each of those objects. Let's go backward. Like for tumor, what is the hottest thing for treatment of the tumor in the spine?
Yeah, actually, the newest thing that I heard, maybe it's also not new for some centers, but they do exactly some hours and some hours before and some hours after the surgery, the radiotherapy, especially 4 hours before that. That was a study that I enjoyed. I think it was in Netherlands.
Yeah.
If I'm right.
So right directly after the tumor therapy to give radiation to the tumor bed to reduce the risk of that tumor comes back.
Exactly.
Now, on the 15th of the next month, please join us online. We have a symposium,
Yeah.
and somebody is going to talk about actually tumor therapy with thermal therapy.
Okay, we do have that.
Yeah.
Yeah, we
So
do have that.
What do you think about the thermal therapy of the tumors of the
Yeah,
spine?
I think actually it's like many other things in a spine surgery. We have to decide about that so individual. That's what I love about the spine surgery. You can put a rule, so 2 times 2 is 4.
Mhm.
So everything is for patients personalized and customized. So because of that, for some tumors and for some patients, that's actually a very good thing that we use in Germany before the surgery or during the surgery, especially as you know,
Mhm.
we have lots of bleeding risk for tumor patients, and with that you can with this thermoablation you can decrease the risk of bleeding a
Bleeding.
lot.
So
Yeah.
I'm actually don't know much about it myself, but I'm really excited for Dr. Fan to come to us next month
Yeah.
and educate us. Obviously, we are going to publish it online. Please join us.
Yeah.
What day is it? Is it Saturday the 16th? I
Saturday the 16th.
So please
Yeah,
stay
sure.
tuned. We are going to learn a lot about that. Now, I want to go back to your other topic, minimally invasive. Now, I want to go around, Amanda, you are not in a medicine per se, and Alyssa, you have been in medicine, but when everybody calls the procedure minimal invasive, what do you understand when people say minimal invasive? What does it come to your mind?
Small incisions.
Small
Yeah.
incision?
That's a good point. Yeah. I will establish that the general population also could be convinced that minimally invasive is anything that you tell them.
Yeah, agree.
Literally,
Yeah.
I get that very often. I mean, for me, minimally invasive comes down to, what is invasive?
Yeah.
Invasive is,
Yeah.
like you said, big incisions, lots of
Yeah.
blood work, long time in the
Muscle.
OR, under anesthesia. So for me, minimally invasive is limiting that down to the minimal, the
Mhm.
smallest amount that it could be possible.
Yeah.
Mhm.
No, educate us, first of all, I know everybody calls his procedure minimal
Mhm.
invasive,
Literally.
everybody.
Yeah.
Even people who open up your belly this big and put all the organ to the side, go
Yeah.
to the ALIF and so on, and they call it
Yes.
minimal invasive. But is there a unified definition of minimal invasive?
I would make it completely easy. So less intervention in comparison with conventional procedures. If I just want to summarize that,
Mhm.
I would do that like this. And for sure, in different societies, in public, in non-medical talks, you hear with lots of names. For example, the doctor operated me with laser.
Mhm.
Yeah. For example, for laparoscopic surgeries, I did laser surgery. In laparoscopy. We don't use a laser or something like that, but it's famous with that,
Yeah.
Um,
Where did the word laser in the surgery came
I
from?
don't know.
No, but I
Because
know
it's
it's
so-
yeah.
It sounds futuristic.
It sounds
Ninja
futuristic.
marketing.
Yeah, it is
Yeah,
actually
yeah.
ninja marketing. Now, let me tell you that when I started my residency in Germany in 1996, that's a long time ago.
Yeah, I can now calculate your age.
You're saying.
Yeah,
Yeah.
we
Barely.
had at that time a laser machine that was collecting dust for 7 years in the closet.
Oh,
And because in 1980s and so on, we thought, right now, let's say part of the disc come and push on the nerve.
yeah.
We go pick it up with the forceps, we put a pill, take it, pull it out.
Okay.
Okay, that's what we do. In 1980s and so on, said, isn't it a great idea, instead of going with the forceps, taking it, pulling out, we vaporize it and we suck it out like a smoke, we burn it out. And something that you could go and take it and pull it out in 2 seconds, you were there 15 minutes, vaporizing it and sucking it out. And then people 6 years, 7 years before I noticed, stopped using that, was collecting dust in a closet. So it was a good idea, But when they increase the volume or the energy of the laser to vaporize more, so they don't have to go half an hour for that,
Mhm.
for something that they could do with the forceps in 3 seconds, then you make the laser would penetrate and cause more damage.
Damage at all.
And that that was 1996. That's a long time ago now. But the the name stuck, and the laser spine, and even it was a company that went out of business because for every month their operation, they had a lawsuit. They promised things that they couldn't deliver. And I talked to one of those doctors. They would just talk about the laser, and they would bring the laser machine, turn it on and off, but then do regular surgery because
Yeah.
even they knew it's really not working. So that is where the word laser is coming from. Now, in some other surgeries like eye surgeries and so on, laser has a huge value.
Yeah, for sure.
But I don't believe anybody, not only we have proven, not only we don't have evidence that laser in the spine doesn't work, but we have evidence that it adds to the complexity, complication, and the time of the surgery in the spine. So we have evidence that's really not a good thing for the spine. Or no, I haven't heard of any reasonable surgery in the last 20 years using actual laser in the spine. Have you?
No.
Okay. So that's something we know. But coming back from that, you remember you said something about the minimal invasive being a smaller incision?
Yeah.
I think what's matter even more than the skin incision is what happened under the skin.
Mhm.
For
Exactly.
lack of other term, in a regular surgery, we don't figuratively, we literally fillet you open.
Mhm.
In a regular like PLIF or TLIF, we go in, we separate all the muscles from the bone. So I was very actually excited being with your Professor Demel in Germany that he did the mini Wilsti. He didn't separate the muscle,
Yeah.
and that is why he has good results.
Yeah,
because-
for most of our patients, we don't do that. So we go intramuscular.
yeah,
So we go, we say that dorsolateral.
dorsolateral, yeah.
Yeah,
Wilsti
yeah,
approach.
we'll
that's
see
called.
approach. Yeah, and then you're gonna have very little of bleeding. So
Yeah.
you experience that in our center.
Now, why is it separating the muscles from the bone a bad thing, Alyssa?
Because then it's causing scar tissue. which-
Well, muscle turns into scar. And as well, the vascularization of the bone is through the muscle. And then you prevent that as well. You got it.
Yeah.
So
You got it.
You got it.
Well,
How
it's
easy was that?
4:30, so-
it's 4:30 now.
Okay.
Actually, I really enjoyed that.
I really enjoyed that, and I
Was that
appreciate
a
it again.
roast?
Yeah, no. I appreciate it again for the chance that I had to be here. And I'm looking forward to more cooperation. So
Yeah.
Yeah,
Yeah.
thank you for joining us. It was
Well,
really
we are
special.
happy to have
Yeah,
you here,
thank you.
Amir.
And if
yeah.
you guys want to continue the podcast, you can, but we just have this meeting at 4:30.
Okay, well, thank you very
Okay.
much.
Thank you
you.
guys for joining. This was Essence of Medicine. Today we talked about surgery training around the world. My name is Amanda Armagoss.
My name is Alyssa Hopper.
I'm Dr. Abbasi for Essence.